Hi, hello, welcome back. So today's topic in pathology is evocative or suppressive testing procedure. The code series is 80400-80439. Okay, so we will be discussing about evocative or suppressive testing. So to understand this, evocative and suppressive testing in pathology involves administering substance to stimulate or suppress a physiological response, allowing for the assessment of endocrine function and other bodily process. These tests are often used to diagnose hormonal disorder, endocrine gland function, etc. So the key concept is evocative test means these tests involve administering a substance to stimulate a physiological response, whereas suppressive test means these tests involve administering a substance to suppress a physiological response. The purpose of evocative and suppressive testing is, first one is diagnosis of endocrine disorder, and second one is assessment of endocrine function, and third one is monitoring treatment. The next common methods used are, first one is stimulation test, that is administering a substance that stimulates the hormone production, and second one is suppression test, which administer a substance that suppress the hormone production. Next, we have to see the common CPT codes for stimulation, that is evocative testing is 80400, 80402, 80408, 80410, 80412, 80420. Next, we have to see the suppressive testing code, that is 80415, 80416, 80417, 80418. In that itself, it will the word will be mentioned, that is suppression word will be mentioned in the code itself. You can go through it. Then the example is a patient undergo ACTH stimulation test. So here the stimulation is done for adrenal gland function. So we have to give stimulation code 80402. The next example is a patient undergoes a low dosage dexamethasone suppression test. So here it is suppression test. So we are coding 80417 low dose. Next, the tips for accurate coding. You have to identify the test. Next, you have to correct the CPT code. Next, you have to read the comprehensive documentation very carefully, and you have to see and verify the medical necessity, and as always stay updated with the CPT guidelines. Conclusion: evocative and suppressive testing are critical for diagnosing and managing endocrine disorder. Accurate coding requires understanding the type of test, the substance administered, and the physiological response measured. By following all these steps, you can accurately code this thing. Thank you so much for watching. And if you haven't subscribed, please do subscribe my channel, and if you have any doubts or clarification, you can put it as a comment. Thank you so much for watching my video. Take care. Bye bye.